Hello, everybody. This is Lisa Johnson and Eric Chetwynd from Everbridge, welcoming you to today's webinar. We're going to be comparing and contrasting the Joint Commission and the CMS Emergency Preparedness Guidelines. Our agenda today is to review the history of the guidelines and where they've come from, a brief overview of the CMS Emergency Preparedness Guidelines, communication details of the CMS Emergency Preparedness Plan, the rolling out of the new Joint Commission guidelines, yes, there are new ones coming, what those updates mean, the differences between CMS and Joint Commissions, and then we are going to have a Q&A. So definitely bring your questions. We're expecting a robust Q&A. You can also follow us on Twitter at EB Healthcare, where we talk about clinical communications as well as emergency preparedness planning. Okay, I would like to introduce the two of us. Eric is the General Manager for Healthcare. He oversees the global portfolio of healthcare solutions, ensuring that the company continues to deliver solutions that best meet customer needs while maintaining the company's position as the market leader in critical communications and collaboration in healthcare. He brings more than 15 years of experience creating and leading solutions to the market. I am Lisa Johnson. I am the Senior Program Manager. I've worked in healthcare for 4 years now, working primarily with physicians groups such as Sermo, which is an online physician platform, and Platform Q, which is a CME company developing continuing medical education for physicians. And with that, Eric, you can take it away.
All right. Well, thank you, Lisa, and thank you all for joining us today. I think just before we dive into some of the comparisons, as many of you know, we kind of wanted to go through a little bit of the history. What's the genesis behind these new regulations that are coming out from CMS? And so I'm sure all of you on the phone certainly remember Hurricane Katrina in 2005 hitting New Orleans, and of course the awful damage that happened there. As part of that is, I'm sure you also well know, there were a number of healthcare facilities which were very badly hit, and it was discovered there were a lot of flaws, really, or opportunities. One way to look at it, opportunities for real improvement around being able to manage the emergency management procedure. Memorial Hospital was certainly one that's well known, has been written about. I'm sure many of you have seen that story, and so between that scenario, basically that emergency, and really Hurricane Sandy, which came and hit in 2012, and also hit healthcare facilities, CMS has announced in sort of the background of their regulation that they've really been taking a look at what happened in those incidents, and really thinking about what really needs to happen from a response and planning perspective, particularly in healthcare systems, hospitals, but really throughout the systems. And as we go through here, many of the regulations that you'll see really are in response to what has occurred out of these scenarios, along with obviously talking to emergency preparedness experts as well. So, just to start off, we're going to run a quick poll question here. And I guess one of the questions is, for those of you who've seen the guidelines, do you feel that you're really ready to go for meeting the guidelines, which are coming out later this year? So if you could just take a quick moment and select an option, we'll kind of tally up the results, and we just kind of want to get a sense of where people feel they're at today.
And we should let people know that we're also planning on asking this question again towards the end of the webinar. We're really hoping to provide you with a lot of information today that you can use, and that will help assuage any anxieties you might have over meeting the emergency preparedness guidelines. So very heartening that only 20% of you don't know, so you should have a pretty good idea by the end of today's webinar, at least as far as communications go. Yes, 23%, yes, we reviewed the information and feel confident. 46% no, but we expect to be in compliance by the deadline. So that's great. We have 67% feel like they're there or they're gonna be there. And to the 10% of you hoping that you'll make the deadline, hopefully today, again, you'll get a little more information. So let's hide the results.
So, really what we're going to speak to is the final rule that came out from CMS, which was actually published last September. and you'll see the timeline as we kind of go through, but it's really geared around this idea, it's written into regulation against your conditions of participation or conditions for coverage to provide a comprehensive, you can read here, consistent, flexible, and dynamic regulator approach to emergency preparedness. That really includes those lessons that we just talked about from those incidents that happened. And really the focus here, there's a lot of, for those of you who have gone back and read the regulations, as most things from CMS are, they're very, there's a lot of verbiage in there, but really they're really focusing on safeguarding human resources, maintaining business continuity, and protecting physical resources is really the focus of those regulations. And they really break down to, the requirements break down into 4 areas. The first is conducting a risk assessment and developing, obviously, your plans from that risk assessment. I'm sure many of you have done that in the past, but there's some additional language in there about how to conduct those. Obviously, implementing policies and procedures based on those plans. Building in a communication plan. This is really a elaborated area under the new CMS regulations, particularly from a little bit separate from what the Joint Commission has typically promulgated out to everyone. And we're going to spend some time talking about that today. And then, of course, training and testing, which is always critical to any of these emergency planning activities. And we'll talk a little bit about that today as well. The other thing we wanted to highlight is that really CMS has taken a look across the board at pretty much every provider type. There are some exceptions here, but there are 17 different provider and supplier organizations that CMS has regulations for. Many of the regulations we're going to cover are universal across provider types. And then there are some differences, certainly based on whether your organization is a facility, a standing facility such as a hospital, skilled nursing facility, et cetera, a service provider, a home health agency, or that type of a provider, or actually just a supporting kind of provider. And then we've provided some, you'll see in the slides, there's a link for a breakdown by provider type as to how those regulations specifically break down. So if we don't get to that today, there is a follow-on resource you can leverage later on. So the Joint Commission, as many of you know, also has traditionally accredited folks against emergency preparedness. In response to the CMS regulation, the Joint Commission obviously has to modify their approach to how they accredit provider organizations. And so we'll talk a little bit about the timing of that. And again, we're going to highlight some differences, but just you understand that if the Joint Commission is who's coming in and kind of doing your survey and your regulations, they will be modifying their accreditation survey process to meet the new CMS regulations. If you're not using the Joint Commission, it's through state regulators, they're also obviously have to meet the new CMS regulation.
And if I could add, this was actually from an audio webinar that CMS did yesterday. This is a direct quote. They were asked point blank during their Q&A, and this was their response. So it's nice, actually, that we have this clarification from them. I think it makes life simpler for everyone going forward. You're not wondering what the standards are. You know, basically, if you meet the CMS standards, you'll also meet the Joint Commission standards, and the Joint Commission is changing to make sure that that happens. So
as far as timing goes, just to speak to this for a minute. So the CMS regulation, the final rule, was published in September of last year and became effective in November of last year. And so on the CMS timeline, that basically means that rule is in place now, and surveyors starting in November of this year will be measuring organizations against those new regulations. So if you have a survey coming up after the November 15th deadline, those surveyors can use that, the new regulation to say, did you do your testing? Did you meet the new regulations? Now, alongside that, CMS is working on guidance to the marketplace, and then the Joint Commission, which is coming out in the summer, according to CMS, right? And then the Joint Commission is actively working to update their survey process and accreditation process to at least meet the CMS regulations. And so you can see the timeline here. They're anticipating that those standards will also be published in this case in July. So in the summer timeframe is when we're anticipating seeing updates from both CMS and the Joint Commission on sort of the guidance of specifics of the regulations and how they're going to survey against those. So let's talk for a minute about some of the differences between CMS and the Joint Commission. I think as Lisa just highlighted, at a minimum, the Joint Commission must meet the CMS regulation. And so the first area of difference here is that CMS is requiring 1 active and 1 tabletop drill per year against your emergency plan. And so that's the minimum threshold from CMS. Joint Commission, as they have traditionally done, is actually going to require 2 active drills per year. So they are meeting the CMS minimum, but then they're actually they're basically elaborating a little bit more and putting a little bit more on top in order to meet their accreditation process. There are some different, you can see the home care program, home health, actually has a little bit of leniency there. So slightly different metric to hit there. The other big difference here is that CMS really is promoting and requiring the tracking of information during an incident that involves the outside community. And there's a lot in the regulations about making sure you do work with your outside agencies and other folks who might be part of emergency planning from a community perspective. The Joint Commission is actually being even more ubiquitous in the sense that they're requiring log information for any incident. So it's not just the ones that involve the outside community, but any incident that you have must have a log in order to meet their survey accreditation process. Oh, and of course, this is the current guidelines, but as we mentioned at the top of the, earlier in the conversation, the Joint Commission is still building out their final set of guidelines. So, there may be some slight variations as we go through the process here, but this is their current guidance on what's going to be different. And with that, I think what we want to do is do a little bit of a dive into the communication plan area. This is an area where we work with a lot of hospitals, health systems today to help them in emergency preparedness around the communication area. And so Lisa's going to go into some details there and share some insights around those differences and similarities.
Yep. So what we did at Everbridge was we went through the entire documentation and we pulled out specific quotes as they relate to the communication plan. As these come up, by all means, if you have any questions, please pop them into the question box and we will address them. So we wanted to start with a little bit of background, which will help inform us for the webinar for today. So I'm going to launch another poll. You can see the poll question there, which is, how do you communicate during an emergency today? I see paging system. Thank you for your votes. It's very vigorous voting. I'm also seeing a lot of phone tree on here. So there's much easier ways. We're going to give it a few more seconds. We are over 80% for the vote. Thanks, guys. So remember, this is multiple, so we'll see. So 56% is the lowest response for phone tree. That's good. That's something that should definitely be waning over time. So yeah, kind of between 60 and 70% for all of the different systems. So that is fantastic that you have multiple modes of communication because that is required in the new CMS guidelines. So let me hide those results and we'll move on. All right, so contacting and tracking staff. From the CMS guidelines, we would expect facilities to track their on-duty staff and sheltered patients during an emergency and indicate when a patient is relocated during an emergency, that is, to another facility, home, or alternate means of shelter, etc. We would expect the facility to include in its emergency plan a method for contacting off-duty staff during an emergency and procedures to address other contingencies in the event staff are not able to report to duty, which may include, but are not limited to, staff from other facilities and state or federally designated health professionals. So what does that mean? What it means is you need to have a way to contact all of your staff. Anybody who's working in your facilities whether they're a contractor, temporary employee, staff, even volunteers, you need to have a way to contact them. And because the CMS guidelines are asking for their availability, either off duty or as if they have problems coming in during an emergency, they need to have a way to respond back to you. So they need to respond to a text or respond to an email or somehow be able to communicate with your facility. And that is something that is new, and it does make broadcasting, for instance, using a public broadcast system, that would not meet the requirements that are coming into place. So you have to look at all the options and before, during, and after an event. For instance, with Hurricane Matthew, which we're going to talk about a little bit later, you have all your facilities, all your available communication tools with you before the hurricane arrives. You might have very little during the hurricane, and you might be getting them back slowly after the event. So you need to think about at which stage, what type of communication you're going to be using.
Just add one point to that, Lisa. I think, as I'm sure many of you on the phone probably think about in your plans today, when they talk about contacting all staff, contractors, entities, obviously it's not just folks who are within the walls of the facility. So if you're running a hospital, but also thinking about transport and outside agencies that you might be collaborating with. And Lisa will go into some more detail, but there is more information about making sure you're reaching out to those outside providers as well.
Yep. Absolutely. And then the other big difference that we're seeing with this set of guidelines is your ability to communicate with the local community. So that's public health officials, state and local governments, tribal leaders. There's a whole range of people that you're going to need to reach out to and be able to contact. Healthcare coalitions are a big one, and they're going to become more important starting in July. I attended the Joint Commission conference in New Orleans last week, and there was a lot of discussion about healthcare coalitions. They're going to be getting more funding, and they're going to be it's going to be required that you coordinate with your local HCC to make sure that plans are in place. So know that that is coming. They're going to need contact information. They're going to need primary means of communication. So do you text or do you call? And then those secondary means of communications that we talked about earlier. The other difference is it has to be documented. So according to CMS guidelines, whenever you are working outside the hospital walls, it needs to be documented and logged. Those two pictures up there are from our Everbridge system. We have a test system called Everbridge General Hospital, and that would be, sort of an idea of some of the reports that you can generate. So during an emergency, it just happens. You don't have to worry about going to an Excel spreadsheet or a notebook and taking notes during an incident. Okay, and the other piece about the community is you need to take into account unique populations. So without reading all of that, you need to think about cultures, you need to think about nursing homes and how do they need to be evacuated. Is there a dementia unit in your near your facility that you might need to address? You need to think about bed matching. If one facility is evacuating to another facility, is it the right type of patient coming to your facility? For instance, you might not want to send a dementia patient to a physical therapy ward. That might be a bad idea. And you also need to think about English proficiency and being able to speak to everyone in your community. So templates can help out there, having everything ready to go ahead of time in a foreign language so you don't have to try to find a translator in the middle of an incident. And we must remain HIPAA compliant throughout an incident. It is spelled out very clearly inside the emergency preparedness final rule. Just because you're transferring a patient or doing a handoff of some sort, HIPAA rules are still going to apply. I know that there are exceptions during extreme emergencies, but you shouldn't plan for that. You shouldn't plan that, oh, we don't need to worry about HIPAA. You will need to worry about HIPAA and do your best to meet compliance throughout anything that happens. Okay, and then a lot of people have been talking about, they're not really going to make us do it in November. this was actually addressed during the comment period, and there's two reasons for this. They consider this a matter of public safety. They're really looking for patients to have the safest possibility and best outcomes during an incident, learning from places like Hurricane Katrina and Hurricane Sandy. And they're also looking, they don't want to have a staggered implementation. They don't want to have, you know, one town has it together, but the two towns over, they don't have it together yet. They want everybody to be in compliance at the same time. Okay, so that was a lot of information. We gave it to you fairly quickly. We already have quite a few questions coming in, but I'd like to ask that poll question again. So does your facilities currently meet the new CMS guidelines? Oh, see, you guys are better than you thought you were. The numbers are strong. Okay, and let me share those results. So 34% of you feel confident that's higher, I think, than when we started. So that's great to see. And then, you know, 60% almost think that they'll be in compliance and be in time. That's fantastic. If you do need help getting there, let us know. And for the 7% who are concerned, you know, please reach out to the resource list that we have or reach out to us, and we can definitely help you get there. So we do have one more poll question. This is the last one for today. So are the decision makers in your facility aware of the guidelines? So it's very possible that you are the decision maker and you're very aware, but are you having any issues higher up the chain, talking to your CEO or CIO or CSO? So this is good. About half have the C-suite involved, and they're working on getting everything moving. And then 43%, they don't know about the details. So if you feel like they need more information, our resources will have a lot of short things that you can send to them. Instead of sending them a 186-page book, you can send them some shorter snippets of information that will help them get up to speed. We are going into Eric.
So, yeah. So it's first of all, it's good to see, as Lisa has said, that a lot of you are moving in the right direction, and hopefully we'll be meeting the guideline. I think we get a lot of questions from customers about, so if I'm non-compliant, what's the risk? What if we don't meet that deadline? And so we wanted to share a little bit of information there. So non-compliance, or the inability to meet the deadline by the time a surveyor comes out to meet with your organization, this particular deficiency would be considered a condition level deficiency for conditions of participation. And so condition level is really the highest, without immediate jeopardy, is really kind of the highest level from a CMS perspective of deficiency. And really one deficiency can be penalized. And really, so the enforcement procedures there are really what happens anytime you're out of conditions or out of compliance. So conditions of participation or the CFCs. For most providers, you get typically a 60-day term in order to come back into compliance. You can come up with a plan and share that back with the surveyor. It can be 60 to 90 days. Otherwise, you risk being terminated from the CMS program. For some facilities, some providers, such as nursing, long-term care, nursing facilities, skilled nursing facilities, there can also be a financial penalty. So the surveyors can actually choose to do a financial penalty instead of just moving straight to termination, and you can see the dollars there. And similar for home health agencies. So there is a lot of weight behind not complying with these regulations, and CMS really is treating them as a very serious issue from that perspective. And as Lisa mentioned earlier, we've put a number of links in here really just to help all of you, and the slides will be available after today's webinar. So if you're looking to either further educate yourself or trying to help get your team or your execs to better understand the situation, there's a lot of information here that hopefully will help you do that.
And if I can actually add, especially if you're looking to try to convince higher ups, the resource number 2, the communication quiz, it takes less than 5 minutes to do. and it very clearly highlights where there are issues in your communication emergency preparedness plan. So that might be something that would be good to send along to someone if you're trying to convince them that this is important. Oh, and then I'm going to actually highlight number 8 because somebody did ask a question about this. So Boston University is our partner. We work with their Healthcare Emergency Management Master's Program, and they went through and did a breakdown by provider type. So there were a couple of questions about what if it's a nursing facility, what if it's another type of facility. So if you download that information, it is a PDF, you will be able to go right to your type of facility and see what the requirements are for you, okay?
So, I think as we mentioned going through today's presentation, the Joint Commission is still going through the approval process. So certainly the guidance we're providing today is based on the latest information available from them. And, part of that waiting is that they're waiting for interpretive guidance from CMS as well. So CMS has obviously published the regulation. And I know there's a lot of questions which we talk to folks about every day. And they're working on their interpretive guidance while at the same time sort of in parallel with the Joint Commission working on their approval process as well. And, just as a side note, obviously we've got a lot of resources in here. We just wanted to highlight that, if you need help, either on the resource side or just understanding any of these questions, we're certainly available. We're going to answer questions in a few minutes, but we do work with hospitals and health systems across the country every day. We currently work with over 1,000 hospitals and health systems across the U.S. So we're certainly here to help you through the process if we can be of assistance. And then just to comment, some of the things that we've done real quick is that to share with you from a solution perspective outside the resources that we've put up in today's slide is, we do have, obviously we're a mass communication vendor, as many of you know, and so our solution is designed for those mass communication capabilities and really helps you address a lot of what's happening from a CMS perspective. One of the key things we just wanted to highlight really and point out today is that we've done a couple things specific to CMS to help folks. So for those of you on our solution, we've actually built a solution kind of bundle that includes templated communications based on the CMS regulations covering the 6 all hazards areas that CMS outlines as hazards. And so that gives you a starting library to really get up and running with templated communications. The other thing we've put together as a general resource is really a communications gap analysis document that can just help you assess in general where you are against the CMS regulations. And then we're just highlighting here, I think, just to give you kind of some idea, we obviously work around emergency management all the time. Hurricane Matthew is one of those examples where we were supporting across the state of Florida and really the Southeast, many of the communications that happened. So again, if you need help, we're here to help. I think with that, we're going to jump right over to questions and make sure we answer those for you on the phone.
I'd also like to say the first question somebody asked was how many people were on today. So we had over 200 people on the webinar today. So the poll results were actually fairly substantial. We had 100 and I can do math, 70, 80 people answering the polls. So the first question, does the tabletop allowance by the Joint Commission apply to all home care, including hospice inpatient facilities, since they are surveyed under the home care standards? That's a very specific question.
That's very specific.
Thank you, Annette. Annette. So I am not sure. What I would say is I would wait for that clarification to come out over the summer. I can give you a little hint to what I think it's going to be, and this is actually from the CMS webinar yesterday, because somebody was asking, and there's another question on here about a healthcare facility within a hospital facility. If you have a separate CCN number, then you will need a separate plan. If you don't, then you can do it as a system-wide plan, and it's considered one location, one entity with several locations. That was the way that it was worded yesterday on the CMS webinar. So take that with a grain of salt, definitely verify with your people, but that's the information that I have. Okay, so for The differences between CMS and the Joint Commission: will 3 drills and 1 tabletop be required? So no, absolutely not. You only need to do 2 drills. Both of those drills, by the way, need to be completed before November. So they have to be done before the November 15th deadline. So for CMS, it can be 1 tabletop and 1 active drill. For the active drill, they prefer that it be community-wide. So you should, plan to work with your local officials and plan to have a community-wide drill. If for some reason that can't happen, then you can have an active drill that's hospital only, but that you would need to actually defend why you couldn't have a community-wide drill. So 1 tabletop, 1 active for CMS. The Joint Commission is exceeding that. They have always done 2 active drills a year, and they are keeping that guideline going forward. Hope that clarifies. Somebody did ask about students and volunteers as part of the contact list. Yes, for volunteers.
So if students are residents, if that's the question for like an academic setting, then yes, those, they would be counted as, I haven't heard CMS specifically say this, but I would imagine they'd be counted as staff, because really what they're talking about is people who would clinically respond to the scenario, to the incident. So and typically that's what we see when we're working with academic medical centers, that those residents are also included.
So did I say that there is more grant money for the healthcare coalitions? So let me clarify. The Joint Commission had a session last week in their emergency preparedness conference, which was all about the strengthening of healthcare coalitions. So this is from my memory. So there is grant money that goes out. Often hospitals can apply directly for this grant money, and what the shift is that is happening is that money is now going to be kind of coalesced around the healthcare coalition. So the HCCs will have a little bit more power in how that money gets distributed in their region. So that is the clarification for that. You would definitely need to check with your HCC. There are new guidelines coming in place for HCCs universally in July. So along with strengthening the CMS criteria, the HCC guidelines are also being strengthened. So definitely go back and check that for your area for how that will play out. How about a psychiatric facility? Is there a requirement to do a community drill? So definitely look at that BU breakdown. It will go through and it will tell you. I want to say that the answer is yes. I want to say that you would, especially with a specific population like that, you're going to want to coordinate with your local health officials and your local police and fire, so that if evacuation is needed, that you have a plan in place to do that in a way that supports the patients. We are a critical access hospital with long-term care facility, assisted living facility, and home care services. Will a unified plan and risk assessment that includes members from each of these facilities suffice, or do each of these entities need to do their own risk assessment? That is from Sandra. Sandra, it depends on how that's structured, and I believe it goes back to that CCN number. So if you have one CCN number, then you can do it as a broad spectrum, and then you are correct that everybody would need to have a seat at the table and be part of the planning process. If each facility stands on its own with its own CCN number, then you would need to actually go through the process for every single facility. Hope that answers the question. And I believe, oh, we have one more. Okay, the ASPR HPP is run differently at every state with the same guidelines. ASPR funding to the states will not increase. Yes, Fidel, you are correct. Thank you. That is in regards to the healthcare coalitions. Thank you for providing that. Okay, I think at this time that is about all. Thank you, everybody. We'll see you soon.